Welcome to today's new family orientation session. Before we begin, we have a few important housekeeping notes to cover.
La traducción al español para esta sesión es proporcionada por Wordly, una herramienta de traducción en tiempo real. Para acceder a este contenido en español, haga clic en el icono del globo en la barra de herramientas del lado derecho de la pantalla y seleccione Español en la lista de opciones de traducción.
Today's session is being recorded. Recordings will be available approximately 3 hours after the session ends. You can find session recordings in your session schedule or in the on-demand page of the Hub. To ask questions during this session, click on the Q&A button in the panel to the right of your screen. We'll answer as many questions as we can, either during the session or at the end. You can submit questions anonymously. Please don't share any personal information in questions, as questions will be visible to all guests. If you see a question in the Q&A panel that you want to see answered, upvote it to let our team know. Lastly, we ask that you please join us in upholding and promoting UC San Diego's principles of community, and in keeping our community free from any and all forms of discrimination and harassment. Now let's get started with today's new family orientation session.
Hello. My name is Dr. Stacy San Miguel. I'm the Director of Medical Services here at UCSD Student Health Services. And I want to congratulate you and your children for making it to UCSD. As a alumni of the UCSD School of Medicine, I'm so excited to have your kids join our UCSD family. Just a little bit about me. I am a family physician. I've been practicing medicine for over 30 years, and I've been here at Student Health since 2003. And so I'm really excited to share what services we have at Student Health here at UCSD. I'd like to introduce you to my colleague, Annie Horton, who's our Director of Nursing. Annie.
Thank you so much, Dr. San Miguel. My name's Annie Horton, and welcome to our session today. We're really looking forward to sharing what we have to offer here at Student Health Services. I've been an RN for over 30 years. I was trained and spent most of my career in New Zealand, which is where I'm from. I worked as a rural nurse specialist in primary care in rural communities, and I've been at Student Health for the last 10 years.
Great, so let's begin. So first thing is that this session is going to be, again, recorded and available on the Family Orientation Hub, as well as all this information that we're sharing is on our Student Health website that you can see here on this link. Next slide. So if you can get any one thing, if you have to learn one thing, this is something that it's important for your child to know, is to make sure they activate My Student Chart, because this is how the Student Health staff will communicate and the CAP staff will communicate directly with your children in terms of health messages, health requirements, and we've actually been communicating with students already. So they can go to this website, mystudentchart.ucsd.edu/SHS, and log in with their AD login to activate their account, and they can check to see if they've received any communications from us and respond directly, and we can give that personalized touch to them. So a little bit more about Student Health Services. We are part of this wonderful Student Health and Wellbeing Cluster. It's a one-stop destination dedicated to supporting students' physical and mental health. This cluster offers high-quality medical care here at Student Health, as well as proactive health education through health promotion services and compassionate mental health support at CAPS. And with UC SHIP, students can access really top-tier medical care here on campus. So our mission is to facilitate students' personal wellness and academic success by compassionate, inclusive, and preventive care and evidence-based care. All students who are paying enrollment registration fees have access to Student Health, and most of the medical services provided at Student Health are available at low or no cost if they have SHIP, or the reduced access fee for Tritons or raft. Our clinic actually reports directly to UC San Diego Health Medical Center, which is the #1 hospital system in the San Diego County, as well as one of the top 6 in California. So because of this strong relationship with UC San Diego Health, the students at UCSD have really access to high quality medical care. And we are, of course, we've been accredited, our clinic has been accredited by HHC since 1995, which means that we are following and adhering to rigorous nationally recognized standards of medical care and safety as an ambulatory care clinic. So where are we? We are located right in the middle of campus. We're on Library Walk near the Geisel Library. And once you're here on campus and you know where Target is, we are right across the walk from Target. We're open for in-person and telehealth care from 8 a.m. to 4 p.m. And then during the fall, winter, and spring quarters, we expand our services. On Mondays, we are open till 6 p.m. and on Tuesdays, Thursdays, and on from 2 p.m. to 8 p.m. And then on Saturdays from 10 a.m. to 3 p.m., we offer additional telehealth appointments for students so they can access healthcare in the evenings as well as on weekends. So a little bit more about our services in detail. Again, we have board certified primary care physicians and nurse practitioners that can serve all the primary care needs of students, including like routine checkups, or if they have chronic issues like asthma, if they have new concerns about skin conditions, or if they're tired, or whatever you see at a regular primary care clinic, we can see here at Student Health, and the students can choose their primary care provider. We also have comprehensive reproductive health services for contraception management, pregnancy options, and STI screening and testing, and cancer screening. And our primary care providers will provide support with medication management, as well as, if needed, we can refer to our specialists, and they're like right down on the east side of campus, a little bit over a mile and a half away. And there are multiple specialists in the UTC area where our campus is located. In addition, we have specialty care here at Student Health. So the sports medicine doctors that care for our Division I NCAA athletes also come here to our clinic to take care of the students that suffered sports injuries while doing, running or soccer or whatever. We have a GYN from UC Medical Health who comes here and takes care of complicated GYN issues. And then we have our own acupuncturist. And of course, we can always refer to the specialists at UC San Diego Health. In addition, if there is an acute issue, like they are acutely ill, or they have an injury, like a fracture or a sprain, or they're not feeling well, they can come into our Student Health Urgent Care. They're available for walk-in visits, no appointments are needed. And we can evaluate them, and if the student looks like they need emergency care, we'll facilitate the transport to the emergency room. Our nurses clinic is wonderful. You'll hear more about this through Annie, but they do vaccinations, titers, TB screening. They fill out those forms that the students need for employment, volunteering, internships. There's pregnancy options counseling and contraception, travel health. We also help treat latent TB infections, lots of nursing procedures such as hearing tests, EKGs, pulmonary function tests. And for those students that need follow-up on their hypertension, or if they need a weight check, they can make an appointment and just come into nurses clinic to get those vital signs done. Now, we are really lucky. We have multiple ancillary support services within our building. First of all is our clinical lab. Here on site, we have a high complex lab here at Student Health that provides a wide range of testing. In addition, students can self-order selected tests through My Student Chart. They can order TB testing, titers for immunity, some reproductive health tests, and they just go through My Student Chart. They can select a lab appointment, get those lab tests done. They don't need to see a doctor before doing these, and then the test results are available. But if they see a doctor or someone in primary care or urgent care, the physicians will order those tests, and the students can just walk down the hall to the lab and get those done. We also have X-ray. So x-ray, we can look at musculoskeletal problems or chest x-rays, and students that are being seen in urgent care will help us diagnose things like pneumonia, fractures, dislocations. And the turnaround time for the results are pretty quick. Usually we get the results the same day, and we can let the students know what those results are and make sure that they get the proper follow-up in treatment. Our pharmacy is board certified. We can fill almost all prescriptions, including specialty medications. One of the things is that we have a wide range of over-the-counter medications like cold medicines, contact solution, Tums, Mylanta, creams, and they're highly discounted. Most of the time, we're cheaper than Target, actually. In addition, for students, if they're not here in San Diego, but they're in California, like during a break, we can also FedEx their medications for free wherever they're located in California. And our pharmacy has lower copays. If they have UC Ship, the students with UC Ship will pay a lower copay at Student Health Pharmacy than at retail pharmacies. Our optometry clinic, the students are really excited to see when we have an eye clinic that can kind of do an exam, a screening exam to provide prescriptions for glasses and contact lenses. And they also help with management and treatment of various eye diseases. And there's such a wide range of stylish, functional, affordable eyewear. The students really, they have so much to choose from. It's a wonderful service to have on site. And finally, we have our behavioral health team and nutrition. So if we have a student who shows up in our clinic in mental distress, we can work with our social workers to kind of work with the students to kind of evaluate them, make sure that they get plugged into the proper services or the mental health providers or specialists. We also have a psychologist on site that can help provide therapy for things like insomnia, anxiety, adjustment disorders, or stress management, and a team of registered dietitians that can help the students with different issues like high cholesterol, anemia, hypertension. The behavioral health and nutrition team work with the medical providers in a multidisciplinary fashion to treat things like eating disorders, polycystic ovarian syndrome, and chronic disease. So we're really a well-integrated team to try to provide holistic care for the students here at Student Health. Now, how to access care? So there's a couple ways that students can schedule appointments. There's an old-fashioned way of calling the clinic when we're open, but the better way is actually through My Student Chart. They can log in whenever they think of this appointment, log in, go to menu, schedule an appointment, choose a type of visit that they want to schedule. And they can self-schedule primary care, reproductive health, nurses clinic, lab, and optometry appointments. We have a really wonderful, they can schedule for in-person or telehealth visits. And so this is a wonderful system for those students that are busy during the day. They're thinking about this at night, and they can access that care and make an appointment themselves. And then if they need guidance, they're not sure where to make the appointment, we have a nurse triage line for urgent issues. They call our main line at 858-534-3300 and press 2. And there's going to be a nurse that they can talk to during our business hours. They're talking to a student health nurse. And then after hours, when we're closed, on evenings, weekends, and holidays, we have an after hours nurse advice line. This is free for all students, regardless of insurance coverage. So people can just call, the students can call, or the parents and family can call this line also if they want to get guidance on what to do for their student. And then for non-urgent issues, we can use Ask a Nurse. So this is through My Student Chart. The student can message the Ask a Nurse team, and the nursing team is staffing this 7 days a week. And they can get back to the student about their question and how to get connected with care. So now I'm going to hand this over to Annie Horton.
Thank you so much, Dr. Sam Miguel. And the piece I'm going to cover now is on the UC health requirements, which all of your students, all of your family members coming to UCSD will be busy working on at present. Many of them have done some of this, and some of them are still in the process. So we have some incoming health requirements to help prevent outbreaks on campus of vaccine preventable diseases. And majority of these diseases that we are focused on preventing are spread through respiratory and airborne means. And so we know that these outbreaks cause significant personal and academic disruption. So we really put a lot of effort into ensuring immunity levels on campus are very, very high, because sadly we are seeing the re-emergence of many of these diseases in the US and in many places in the world, such as measles, varicella, meningococcal. So we're working really hard at the moment on this. Our health requirements here for UCSD include tuberculosis screening. So all incoming, transferring students, readmitting students are required to do a risk screening assessment, and for those at higher risk to do testing. And then we have a series of 4 core vaccines that we want students to be up to date with, and that includes Tdap, MMR, chickenpox, meningococcal, with a very big focus right now on MMR because of the measles outbreaks. And then we have seasonal vaccines that students can get during the fall quarter once they're in school, and that is generally the influenza vaccine and the COVID vaccine. And again, like Dr. San Miguel said, all of this work occurs in the EPIC student portal called My Student Chart. And your student just has to sign in to activate it once, and they sign in using their student ID, which is their UCSD email address and the password they were given, and it's in that blue box. They should not use a username. That other means is how UC San Diego patients access their portal, so they really need to go in as a student so that they're seeing all the student health and university requirements in there. So the TB deadline has just passed, and academic holds for those that haven't met this requirement actually go on at midnight tonight. So we're working very hard to help many students get up to date as we speak. So as I said, all students are required to do this TB questionnaire, and if prompted, the system will be able to interpret that questionnaire and determine if students are at higher risk, which prompts them to take our form to their healthcare provider for testing. We accept TB skin testing, which is a little bit of tuberculin injected up under the skin and then read in 2 to 3 days. We accept IGRA blood testing, quantiferon or T-spot, and also chest X-rays. A student health RN, registered nurse, will be reviewing all of the testing that is submitted and will communicate with your student as to whether they meet the requirement, if testing is required, and if anything is missing, they will be prompted and asked to supply additional details. And so very important to return on a regular basis to My Student Chart to check for messages from the nursing team. Really good idea to set My Student Chart up with notifications so that your student gets texts or emails to let them know when there is a message pending there for them to read. The regular immunisation requirements, those core 4 vaccines, we set a deadline of July 14th, which has just passed, but we do allow students a little more time to get fully up to date with all their vaccines, and we don't place academic holds for non-compliance until November 1st, so part the way through that full quarter. We really urge students that have gaps or are uncertain to use our immunisation form. Your students can use their own vaccine records if they're very complete and clear. Otherwise, this form is designed to be taken to their healthcare provider, and the healthcare provider can fill in the dates, provide any missing vaccines, and also order blood testing if that's what's appropriate. For MMR and varicella, blood tests can act in the place database of vaccine dates. And so they should complete as much as they have before they start school, and then we can update that as they receive more vaccines during that early part of the full quarter. We do allow exemptions. We have medical exemptions for CDC approved reasons to not receive vaccines. For example, anaphylaxis, allergies, previous past reactions, immunosuppressive conditions, or medications. We also have a provision of religious exemption, and those forms are also on our website and will be submitted through to Ask a Nurse and forwarded to myself and processed by our medical directors. Our seasonal vaccines are updated each fall and winter quarters, and so both COVID and influenza come out with a new updated variant every fall, and so we have them available here at Student Health and Nurses Clinic and what we call a fast track vaccine clinic. Students can book those online and come in and get those very quickly. In addition, we also offer Tdap and HPV alongside those seasonal vaccines, and then all other vaccines are a regular nurses clinic appointment, and the seasonal vaccines can be opted out if desired. So just a summary of deadline and enrolment hold dates. As I said, the soft deadline has passed, but the hold dates for TB is already upon us, and so if your student inadvertently does get a hold for not completing the TB requirement, as soon as they do either the questionnaire or submit testing and we have processed those, then those holds will auto lift within 24 to 72 hours. They're welcome to send us a message if there is a concern around that. Or if class enrolment is pending, because the hold will prevent enrolment in fall classes. And so for immunisations, we allow, as I said, up till November 1st, and then holds are placed, then preventing enrolment in winter classes. So really urge your students to get up to date and get in this process, submitting and communicating with us so that we are working with them to help fill in any gaps that they may have in vaccines and help them to achieve that compliance. To get help, the best way is to send a message to Ask a Nurse. So that is accessed through My Student Chart. On the menu tab, there is an actual My Student Chart for students, and Ask a Nurse specifically for students. That comes to a member of my team. I have members of the team, staffing that 7 days a week and in holidays, and so they can expect those queries to turn around in approximately 24 hours. Sometimes, like at the moment around deadlines and hold dates, that can sometimes take a little longer, but mostly at the moment we're answering those queries in real time. There is an email address here that is strictly for technical issues. Please don't have your student to submit any health information that way, as it's not a safe way of transmitting health information. But if they're having trouble logging in or uploading documents, etc., that would be an email address to use. Everything is on our website, and so you can go in there. There's all forms, there's information on the policy, there's a wealth of information there, so it's worth checking out. We have a dedicated page just to this whole process, and we really, as I say, urge people to complete these as soon as they possibly can. Right, so now a little bit of a change in direction, looking at urgent, after hours and emergency care. So the first thing I want to talk about is telehealth visits. So these are an extremely convenient way for students to access primary care. We have student health providers being able to offer telehealth visits through the week from anywhere in California. We cannot do this from folk outside of the state, but if students are within California, even on breaks, they can access us through telehealth visits, so they can maintain their connection with their primary healthcare providers or one of our providers as needed. They also have access to telehealth visits through UC San Diego Health Express Care, and I'll talk a little bit more about Express Care as we go on, but they also offer daily appointments for this and the weekends and some holidays. And then we also have an option for something called Live Health Online for students that have UC SHIP insurance. It is a discounted telehealth service available for students 24/7. So urgent care and express care. So as Dr. Sam Miguel covered, we have a wonderful urgent care here on campus, and that's available to all registered students, and that's open through weekdays. We also have, as I said, the express care, which is that we have multiple locations off campus of UC San Diego Health Express Care. These are also available for in-person appointments. So these are appointments that perhaps if people can't wait to get into their primary care provider, but it's not of an emergent nature, so they can be seen at an express care. Very, very convenient. And then we have multiple urgent care centres within 5 miles of campus, and there's an extremely good one just down the road from campus within walking distance that UC San Diego Health run that keeps very good hours, and so that continuity of care can be maintained. So emergency care, UC San Diego Health Jacobs Medical Center emergency care is just under 2 miles from campus. It's a very, very good state-of-the-art center. We can assist with transportation, but students can call the ambulance. There are rideshare taxis. They can get rides from their friends or roommates or campus police, depending on the how emergent the situation is, but it's very, very close to campus. Students without UC SHIP should always contact their insurance provider first to verify coverage and potential co-pays, just to add that in there. And we do really strongly urge students to visit urgent care instead of the emergency department if their symptoms are urgent but not life-threatening, and obviously if urgent cares are available to them. And bearing in mind there are also the nurse triage lines. Students can call that number in real time when they're not sure where to go or what level of care is appropriate for the symptoms that they're experiencing. And regardless, 24/7, you'll either get one of our nursing team or you will get one of our after hours nursing team. And so they will be able to provide that advice as to the best place given those symptoms. And then for anything non-urgent, obviously Ask a Nurse is available there too, and someone will pick that up in due course. But if it's more emergent, then the nurse triage phone line would be more appropriate. And I'll hand it over to Dr. Sam Miguel.
Review. There was a UC SHIP session from July 16th that people can look at the new Family Orientation Hub to learn more. But all UC students, as part of their admission requirements, are required to have health insurance, and everyone is automatically enrolled in UC SHIP or UC Student Health Insurance Plan. But if they can waive out, families can waive out as long as it meets the waiver criteria. UC SHIP provides comprehensive coverage with medical, mental health, dental, pharmacy, and vision care. And if students have SHIP, they can certainly come to student health and everything is covered. The only co-pays right now are for prescriptions. So there was a question about what is RAFT. It's a reduced access fee for Tritons. It's an access fee for students who have waived out of SHIP and they want to access student health for low cost. It's $70 a quarter. And I can tell you this is probably the best deal on campus because any services that we provide in-house at student health are usually covered. There are some, so for example, if primary care visits, any in-house labs and x-rays are covered, and prescriptions are sent out to a pharmacy that accepts students' insurance. So an example is if a student comes in, they have a sore throat, we can see them, we can test them for strep throat, mono, influenza, and we can diagnose them, and all that is covered by RAFT, and we'll send the prescription out if they need antibiotics to a pharmacy that accepts their insurance. They can come back after that visit within the same quarter. Let's say they have a UTI or they develop gastroenteritis and they're not feeling well, and they can be seen at Student Health, and most of the services are covered. There's more information on our website. This is really ideal for students living on campus if they don't have transportation, especially those with Kaiser, because the nearest Kaiser clinics are not that close to campus. And it just allows easy healthcare on campus at Student Health. And there's more information about the RAFT program on our website at Student Health and Wellbeing. And finally, medical records and privacy. So, of course, we have to abide by HIPAA and FERPA federal guidelines for privacy. We cannot discuss students' medical information with parents or guardians or teachers or professors unless the students have given express authorization to do so. In order for us to be able to release information to parents or guardians, the students have to complete an authorization to release or exchange confidential information form. It needs to be completed and needs to be submitted to our medical records team. In addition, if your child is a minor, if they're going to be under 18 at any time that they're at UC San Diego, we need a consent for medical treatment for minors to be signed by parents to receive care here at Student Health Services. And again, there's a link there for the forms, consent forms and release of information. So I just want to thank you for taking the time to attend this. I've had 3 kids go through college, so I understand how exciting and yet how scary it can be for both parents and students. But there's a lot of things that I've learned over the years. And I also had a daughter who graduated from UCSD in 2022. First of all, I know it's overwhelming, but taking deep breaths and baby steps, making sure that they're doing those things to take care of themselves every day. Can't tell you how often we see students in our urgent care who are dizzy, lightheaded, not feeling well, fatigued, and oftentimes they're not eating, they're not sleeping, they're not drinking. So just that basic self-care is important. Time management is key. Our quarters go fast. They have 10 weeks of instruction and then finals. And so if they fall behind during the quarter, it's going to be very hard to catch up before finals week. And so time management is key. We have programs through health promotion and CAPS and also throughout the clinic, throughout campus about time management and procrastination. Tell your kids, don't be afraid to ask for help. If they're struggling with a class, please go to the office hours that are posted by the TAs or the professors. That's what those office hours are there for, and they can be very helpful. And then the deans of student affairs are extremely helpful. Each college, if you're in the undergraduate, if it's an undergrad, each college and also the graduate programs have a dean of student affairs, and they're there to support students in the non-academic realm. So if there are basic needs or something's happening in the family and the student needs additional help, the deans of student affairs are amazing, and we work very closely with them to make sure that the students get the support that they need in order to be successful. Remind your children that they are not alone. Others around them are probably struggling with the same problems. My daughter was in a triple her first year, and it actually was good for her to see that she was not the only one who kind of was dealing with similar issues. And again, get involved with clubs or sports or campus organizations. There are so many different things here on campus that students can look into, and also just encourage them to have fun. This should be a fun time. And I think, get to know people, kind of connect if they can, do something that they love for 30 minutes a day. We have a craft center, we have recreation. There's so many different things that students can do. We really want the students to enjoy their time here, and there's so many resources. So I think I just want to congratulate you again for and your children for getting into UCSD, and just to let you know that we're here to support in whatever way we can. So I think it's now time for question Q&A. So any questions?
Yes, we do have a few questions in the chat, so I will read them out loud for the both of you. And you can just take turns answering as you see fit. So your first question is, how do you choose a primary care physician through UC SHIP? And Dr. San Miguel is still muted if somebody would unmute her.
Okay.
Perfect.
Am I still muted?
You're great. We can hear you.
Okay. So if they have UC SHIP, then their primary care clinic is the student health clinic. And so we tell students they can go online, look at our website, and find someone that they feel like they would be comfortable with, and request that as their primary care provider. But students can also change their mind. So if they find it's not a great fit, they can always change to a different person who they feel is better.
Thank you, Dr. San Miguel. The next question, my student uses a specialist practicing at UCI. Would this specialist be covered by SHIP? And I assume that would be UC Irvine?
Yes. So ideally, it would be, well, let's see here. I think it should be, but it might be, we'd have to look to see, because UC Irvine is on a different SHIP program now. And so we would have to figure out if it's in network or out of network. And so it probably would be, but I don't know if it would be in network or out of network.
Okay, and then we have, where do we find the authorization form to release information? That is available on our website. And we have a few requests for links. We can start posting those in the chat as the webinar is closing, and all the questions and answers will be saved for your reference. So I'll make sure to put some of those links in the chat before we finish today. And you'll be able to reference them afterward.
Yeah, and you can always Google UCSD Student Health Services Medical Records. You should be able to find the link too that way.
Okay, I have another question for you. Where can students store prescription medication, which is a pen type injection that requires refrigeration? Does the clinic have the refrigerator that the students can store their medicine?
Oh, that's go ahead, Annie.
No, we cannot store outside medicines in that way, but generally speaking, if they're coming into housing on campus, then they would have access to a small refrigerator where they could store.
Thank you, Annie. Next question, where can I find the cost structure of UC SHIP?
Probably I would refer you over to talk to our student health insurance coordinators and our UC SHIP to discuss that. They have detailed information about UC SHIP.
And we will include in the chat or in the Q&A the link to the insurance website and the email address, which is probably already in one of the answered questions. Their email address is ship3, the number 3, at ucsd.edu. So we'll put that in so you can reference it. Okay, next question. I joined late. Could you please explain what needs to be submitted by today? What hold date means? Thank you.
The hold date is an academic hold that is placed for not meeting the final deadline for. So today's hold goes on for not having done the TB requirement, but the immunisation requirement hold is not on until November 1st. So students have a period of time to obtain anything that they're missing to get full compliance up until November 1st. But students need to have completed their TB risk screening questionnaire, which is done through My Student Chart, and if prompted, also testing.
Okay. My transfer student is currently enrolled in both summer sessions and accepted into fall. Can they use SHIP now and select a PCP now?
Usually SHIP, I think the plan year begins September 1st. So I don't think, there are some programs that do have an early start, but I think if they're in undergrad, their plan would probably start with the new academic year.
Thank you. If we use our own health insurance, do we need to change the student's primary care provider close to campus?
That would be really good if you could identify a primary care provider close to campus before the student gets here. Oftentimes people, you don't plan on any emergencies or any problems, but what we find is if they don't have a primary care provider close to campus, then that adds an additional burden when something is happening for the student to find a primary care provider before, when something happens. So we strongly encourage, and I think also it's part of the waiver criteria, they have to have a primary care provider within, I think, 35 to 40 miles within campus.
Thank you, Dr. San Miguel. So I'll read the next question here. We do have a lot of insurance questions coming in. So I'll reference everybody back to the UC SHIP presentation that was done a week or two ago. There's a lot of really good information there directly from our insurance experts. So our team can do the best to answer, but we're more experts on the medical side, providing care for students. So we can answer insurance questions today, but just know the expertise will be with the insurance team, and you can follow up for any specific questions about your situation with them. So the next question, if my daughter signs up for SHIP, is it valid only during the school year or for a full year?
Oh, it's for the full year. And so if your daughter is enrolled in the spring quarter, it actually covers through the summer quarter as well until the new fall quarter begins. So SHIP is good if you have SHIP the entire year. It's good for the entire year. The fall quarter coverage only covers the fall quarter, and winter quarter only covers winter, but spring enrollment covers both spring and summer. And if students have SHIP when they graduate, the coverage lasts until the fall quarter begins and they can be seen at student health. So it gives them a little bit of extra buffer after they graduate.
Okay, next question. Does SHS offer any dental services? If so, would RAFT cover any of them?
Oh, I wish we don't have any dental services here at Student Health. I think that's one of our dreams. But there are so many wonderful dentists in our community. That's the beauty of being in San Diego. And a lot of the dentists that we use are very student focused and really, really great with students. So, and then RAFT wouldn't cover because RAFT only includes services that are provided within Student Health.
Okay. Next question. My daughter has Anthem Blue Cross HMO. Can she use this insurance seeing doctors on campus?
No. Well, she could be seen at Student Health Services, but there would be a charge for her to be seen here. We try to keep our costs low and testing low prices and everything, but she could be seen here, and then we would give her a bill to be seen, and she could kind of submit it to her insurance company for reimbursement.
Thank you. This one might be for Annie. My child has 2 COVID vaccines already. Are they required to have more?
It depends when the last one was given. So the requirement now is the same as the influenza vaccine, and an updated dose is required in the fall and winter. So those earlier doses that most of us got no longer are offering any protection. So each fall the COVID vaccine is updated, just like the influenza vaccine is updated, and that is what is considered the most current, and that is what the requirement covers.
And another question about the medical forms. If we have a healthcare proxy for our child, do we need to fill out the authorization form?
I would say yes.
I think so, yes. They're two different things to my mind.
Yeah. And I think there was another question of like how to submit it. And
Mm,
so you can certainly fill out the forms, or your child can fill out the forms. And then they've been uploading forms through my student chart to Annie's team. So they could certainly fill out the form for the medical consent and then upload it into their through my student chart into their media and send it to the medical team that way. And that way, no protected information is kind of sent out into the email.
yes, and it would sit in the chart and be visible when they needed to receive care. So that would be perfect.
Great, thank you. Okay, we have a few more questions rolling in. Somebody says, just wanted to clarify, is enrollment in UC-SHIP automatic for students? You just have to opt out if you already have insurance?
Yes, enrollment is automatic. So there is a waiver deadline. So if there, so it's in September, but I would make sure that if you have your own insurance and you want to waive out of UC-SHIP, make sure you do it before the waiver deadline in September. There's a waiver deadline and then a late deadline, but there are consequences if you miss a deadline, you probably will get SHIP for that quarter. So yeah, and if you waive out, we would encourage you to get RAFT.
Yes. And there are a few questions in the chat regarding like UC care PPOs and those types of things. And at this time, Student Health does not bill outside insurance. So we have UC-SHIP, or students have RAFT, or they can see us, we charge fee for service and seek reimbursement through your existing healthcare policy. But it would be very important to check that they would cover the care with us. Some do, some don't.
Right. And then if you do waive out with a health insurance like UC Care or any other health plan, we're also like, there are UC San Diego Health primary care clinics near campus. So they could certainly sign up with a primary care provider near campus, or there are multiple locations throughout the county. The other thing is if they need to access care, the Express Care is run through UC San Diego Health, and that takes all insurances except Medi-Cal. But that's also an option for students that have waived out of SHIP and they need health care. They should look into the UC San Diego Health primary care clinics or their Express Care clinics for, for urgent care needs.
Thank you. Okay, we have time for a few more questions. This one is, my child has an EpiPen. Do they need to register it with SHS?
No, they don't need to register, although it would be very, very useful to know so that we could add it to their chart in case they needed to access care through us.
Yeah, and if they have SHIP, it would be great for them to establish care so that the refills for the EpiPen would be a lot more smoother.
Yes.
Okay, another question, is the COVID vaccine mandatory or optional?
It's required, but it is available to be opted out of. And of course, if there's a medical indication, but you can opt out due to strong personal beliefs.
Yeah, and there was a question also about when to get the flu and COVID vaccine. The best timing, Annie?
Yes. So in the fall is really the best timing before we start seeing big spikes in numbers, because COVID and flu are very disruptive to the students' academic life. So the sooner the better. We usually have it available in nurses' clinic coinciding with the beginning of the academic year. So the students can come in, and many, many thousands of them do.
All right, one more about insurance. If we submitted our insurance, will this opt us out from UC-SHIP, or do we still need to complete the waiver?
I would complete the waiver to make sure. Yeah. I think a lot of people automatically think that they're opted out. So I would make sure that you complete any waiver forms before the deadline. It's a very stressful time when people realize they haven't completed the waiver.
Okay. That is just about all the questions we have so far, other than requests for the links, which we will grab now. We have until 5, so if people have additional questions, we can stick around. But it looks like maybe we can close up.
Great. Well, thank you, everyone.
Thank you so much for joining us.